Though most known for its incredible wildlife and biodiversity, Costa Rica is also known for its successful healthcare system. In the mid-20th century, in response to a growing interest in the social well-being of its citizens, Costa Rica formed their social security system, CCSS, Caja, Costarricense del Seguro Social. In the coming decades, CCSS brought a deepening commitment to universal health coverage for all citizens, irrespective of their ability to contribute to the system. Over time, it became clear that without a strong rural and primary care system, universal coverage could not optimally function. Thus, in the 1990s, Costa Rica underwent a major healthcare reform that included dramatic changes to introduce a strong primary healthcare system. The reform had two overarching goals: to expand coverage to those not currently reached by the system, and to provide more comprehensive care, including preventive services. A major and unique feature of the reformed system included the addition of BioDiversity, the Spanish acronym for the Integrated Primary Healthcare Team. The advice teams are geographically distributed across the country according to population density, among other factors, and are designed to provide interdisciplinary, comprehensive, and preventive care to their assigned communities. They are the mandatory entry point into the healthcare system for all community members. As people's health needs become increasingly complex, the advice serves as a point of referral into the secondary tier of care, the local hospitals.
Hi, so I'm here in Costa Rica, and we're going to use Costa Rica as a case example of a country who has implemented relatively successfully universal health coverage and a very strong primary healthcare system. And so behind me is a primary care center located here in a rural community, and here these centers are called EBAIS and EBAIS. You'll be hearing from Dr. Ferron. He is a physician, and he will be talking about the role in the community that the advice plays and the referral systems in place that send patients to local hospitals in the secondary tier and then tertiary hospitals in the urban city centers.
But here around a population of around 4,000. So there's actually two advices here. In this infrastructure here, there's two advices. So there's two MDs, two nurses, two technical pharmaceutical technicians, two ATAPs, and they divide the device. Basically, the infrastructure is divided in two. This side device one and this side device two. So around 70 children she's supposed to screen. So she screens for visual, she screens for blood pressure in all their adolescents. She screens for a height, weight, oral, ENT, ears, nose, and throat. She does basically a general checkup on these children to make sure that they're all right, and then they all have a file that they're all part of the system. So here in the primary healthcare clinic, other than providing the services that the general community needs in the such as the prenatal control, nutritional services, morbidity services, we also provide here in the primary healthcare clinic the basic odontology or dental oral health services. So this is the first point of contact for the community to get that preventative oral health services that they need. So what we're seeing here is the dental equipment that the secondary level hospitals provide. So it provides a very specialized service here, everything from endodoncy and surgery and other things that in secondary you might need in the oral health services. It's a contrast to what is provided in the primary, which is much more preventive. Here it's much more curative. But as you can see, it's integrated in the overall health system.
Costa Rica's model has successfully created a tiered approach to healthcare delivery that begins in the communities, has decreased resource strains on local and regional hospitals, has increased access to comprehensive care and preventive services for the majority of its citizens, and best of all, has led to improved health outcomes and the social well-being of the country.